Welcome to the first annual update from A Better Start National Evaluation.
Welcome to the first in a series of 5 podcasts where we talk through some of the findings of our evaluation of the A Better Start £215 million programme funded by the National Lottery Community Fund. A Better Start, commonly referred to as ABS, is a 10-year program running from 2015 to 2025, made up of 5 partnerships based in Blackpool, Bradford, Lambeth, Nottingham, and Southend, who support families to give their babies and young children the best possible start in life. Working with local parents, the 5 ABS partnerships are developing and testing ways to improve their children's diet and nutrition, social and emotional development, and speech, language, and communication. The work of the program is grounded in scientific evidence and research. ABS is place-based and enables systems change. That is, to change for the better the way that local health, public services, and the voluntary and community sector work together with parents and communities to improve outcomes for children. It aims to improve the way that organizations work together and with families to shift attitudes and spending towards preventing problems that can start in early life. We, the ABS National Evaluation Team, are a consortium of 5 organizations who are evaluating the impact of A Better Start: NatCen Social Research, Research and Practice, RSM, the National Children's Bureau, and the University of Sussex. We will be running a series of 5 podcasts documenting the findings of our evaluation as we go along. Our evaluation work is divided into 4 different parts. Each part of the evaluation is running at the same time. In this first podcast of the series, we will be talking to the lead of each evaluation part to hear from them how progress on the evaluation is going so far. They will also talk about any challenges they've come up against, how they're dealing with those challenges, and what work they plan to do next. The first part of our evaluation work is being led by NatCen and identifies the contribution made by ABS to the life chances of children. This work is being done through collection of data about child outcomes from NHS Digital and the Department for Education, as well as reviewing data which is being collected locally in each of the 5 ABS partnerships. The second part of the evaluation, also led by NatCen, identifies how ABS services contribute to improving children's diet and nutrition, social and emotional skills, and language and communication skills. We are capturing this evidence through interviews with staff who work within the ABS partnerships and from professionals who work with the National Lottery Community Fund. We are also carrying out interviews with early years professionals based in other parts of England that are not part of the ABS program to understand any differences and similarities in non-ABS areas. The third element of our evaluation work is being led by the University of Sussex. They are working with families across all 5 ABS partnerships to understand the experiences of families that have been part of ABS. And the fourth part, led by RSM, evidences the contribution made by ABS to reducing costs to the public purse relating to primary school-aged children. We are using an approach known as contribution analysis to bring together the 4 different parts of the evaluation to form a mosaic of evidence. This will help us to tell the contribution story of the effect which ABS has had on the lives of families with babies and young children. This podcast comes at quite an early stage in our evaluation work, so we will be talking about what we've found so far as well as our plans for the next 12 months. We're going to chat now with the 4 people leading the different parts of the evaluation, which, as we'll see, are all at different stages of progress. We will speak first with Dr. Andy Fugard from NatCen Center for Evaluation, who is leading the part of the evaluation which identifies the contribution made by A Better Start to the life chances of children. Let's start with a quantitative part of the evaluation that's looking at whether ABS has an impact on improving key outcomes for children and families who take part. Andy, you're leading this work. Can you tell us what activity you've completed so far?
I'd be delighted to. The main activity we've completed is deciding on an approach to take for this strand of the evaluation and beginning to recruit beneficiaries to take part. It perhaps sounds straightforward, but as there are 5 partnerships on 120 projects and ABS aims to improve outcomes in a number of areas, this has been a real challenge. The approach we are taking involves trying to estimate what beneficiaries' outcomes would have been if ABS hadn't been funded in an area. We then compare their actual outcomes against this estimate to work out if ABS has had an effect. We will do this by drawing on existing national health and education data from NHS Digital and the Department for Education and information from partnerships on what services people have accessed. When we get the final data for analysis, it's not going to contain anyone's names or personal information, but we still need to ask ABS beneficiaries if they're okay with their information being included somewhere among all of the data that we'll be analysing. So a key step was working out how best to explain the evaluation to families who use ABS services and to ask their consent and be really clear that if they don't want to participate in the study, it won't affect their ability to take part in ABS in any way. We've received valuable advice from an expert panel of parents and carers who've been engaged to support the National Evaluation Team. They've helped us think about what questions parents and carers might have about our work and what people might want to know before deciding whether to give consent. All this advice fed into the design of information sheets we've produced for ABS families that aim to clearly describe what we're doing. We've also had lots of meetings with each ABS partnership to think through the best way to introduce this recruitment process in their area. Getting the beneficiary recruitment process up and running needed quite a bit of careful work, and we're really grateful to each ABS partnership for their support with this. We're pleased that the process is beginning to be rolled out, and families are already signing up to take part in our evaluation at 2 partnerships. Alongside all this work, this year we've also been busy spelling out our plans for how exactly the analysis will be done. This has involved some initial analysis to pick areas that we will use as comparison areas for the ABS sites. To do this, we've used publicly available information on 25 characteristics, such as levels of poverty and health in each area, and how much local authorities spend on services for children. These are examples of characteristics unrelated to ABS, which might be associated with change, so it's important we take account of them.
Has your quantitative work produced any findings yet?
No, not yet. So our main findings will be at the very end of the evaluation in 2025. We have to wait for participant recruitment and then wait some more for engagement with ABS to have an effect before it makes sense to request any data. I mentioned the work on finding comparison areas for each ABS site. We now have those comparison areas. It's been really interesting to see geographically where these have turned out to be. There are similar kinds of places to ABS areas, for instance, whether or not they're on the coast, even though the analysis approach we used didn't know where the coast is.
And what would you say have been the main challenges you've had so far in working on this part of the evaluation? And also, how have you overcome, or how do you plan to overcome these challenges?
Well, prepare for understatement. It's been a bit of a learning curve to work on an evaluation of this complexity. I think the main challenge has been understanding the variety of ABS services and finding an approach that added something to the existing local evaluations taking place in each of the 5 partnerships. We've also had to ensure our approach was sufficiently complex so that it reflected the breadth of work that ABS partnerships do, but without oversimplifying, whilst also ensuring that the approach we took was feasible. So we could have attempted to add a few dozen more outcome measures, for instance, but this would have made the approach much more difficult to manage. It's not uncommon for evaluations to look at one service or project, and for this evaluation we have 100 times that. There have also been challenges learning about what would be feasible at this scale. Partnerships have similarities, for instance, because of the aims of ABS, but each partnership is also unique. So we've had to learn lots about the systems and processes they have in place, for instance, how beneficiaries first access services, and what IT infrastructure is in place to record who has and hasn't consented, and what services those who consented used.
And finally, Andy, what work do you plan to carry out over the next year for this strand of the evaluation?
Our immediate focus right now is working with partnerships to ensure the recruitment process is up and running. Then we'll have a bit of an anxious wait to see whether we have enough families choosing to give consent or not. We'll be monitoring this as we go along, so if there are any challenges, we can adapt our approach. We'll also be finalising the study plan I mentioned, which sets out exactly what analysis we're doing and why. This is really important so that anyone reading our findings can see if we did what we promised we were going to do. We're also going to be starting to bring together existing evidence that's been produced about ABS from the local evaluation teams.
That's great. Thank you very much, Andy. We're now going to speak with Rebecca Hammonds-Beck from NatCen Centre for Children and Families, who's leading on the work exploring how ABS is being implemented as a program. So we know that ABS is trying to make children's and families' lives better. And to do that, ABS is focusing on 3 different aspects of children's lives: food and eating, speaking and communicating, and feelings, relationships with other people, and well-being. ABS is also aiming to bring about systems change, that is, to change for the better the way that local health, public services, and the voluntary and community sector work together with parents and communities to make children's and families' lives better. Rebecca, you're working on finding out what works and what doesn't work across ABS to reach those goals. Can you tell me a little bit about what activities you've completed so far to do this?
Mm-hmm. Yeah. First of all, thank you for inviting me to take part in this podcast. As you said, a team of colleagues and I are working on finding out more about how ABS is trying to improve children's lives. We are very interested in learning more about what works well and what doesn't work well in ABS across the different ABS partnerships. To do this, we have been speaking to different people involved in ABS to hear more about their thoughts and experiences. So far, we've spoken to around 40 professionals across the 5 ABS partnerships, and it's been a real mix of people and experiences. Some people are very involved in ABS and know a lot about the programme as a whole. Other people are involved in one project or service specifically that they know inside out. We have spoken to practitioners such as midwives or speech and language therapists, managers of services such as children's centres, other researchers looking at ABS and professionals sitting on ABS partnership boards. We have also spoken to people at the National Lottery Community Fund and to some people who work in areas that don't receive ABS funding for comparison.
Rebecca, could you tell us about any headline findings so far?
Well, first of all, it's been a real pleasure to talk to so many people involved in ABS. Everyone so far has been really keen to take part and share their experiences, so that's a great sign. Then, let me see, the first finding has to be just how complex ABS really is. This should come as no surprise to anyone who knows ABS even a little bit. ABS is so huge and varied. For example, we heard about everything from a specialist support service for children with learning disabilities and their parents, to a book gifting scheme where children speak and learn more words, and a range of infant feeding support services to ensure that babies and toddlers are getting the right food and nutrition. However, despite this huge variety, the idea behind ABS is that there is a shared way of working across different sites and services. What's great is that we are already hearing about examples where this shared way of working is happening. A key part of the ABS way of working is to include and involve parents at every level. We've already heard of promising practice in this area, for example, a peer support project for new parents that successfully trains people up, and many of their paid members of staff used to receive the service themselves. Another element of the ABS approach is what we call test and learn. This means adapting in a responsive manner to learning about what works well as the programme progresses. Test and Learn draws on national and local evidence as well as the experiences of programme staff. It does so in order to change and adapt service delivery to what the evidence tells us works well. For example, a service offering support for children who are struggling with speaking and communicating was evaluated and shown to make a difference. As a result, the local authority is now considering rolling out the service more widely. At the same time, professionals also told us about challenges they face in delivering services and meeting needs. In our interviews, professionals talked a lot about how poverty impacts families and how the ABS programme hasn't always been able to address the complex challenges families are facing as a result of poverty. For example, we heard about how poor quality housing was a real issue in at least one of the ABS areas, and that addressing this would have a huge positive impact on children's and families' lives, health and well-being. However, ABS just can't do that. So yes, we are starting to get a real feel for ABS. There is some early indication that ABS is changing ways of working and that there is a shared vision in each area. And we're really excited to find out more as time goes on.
And Rebecca, what would you describe as the main challenges that you've experienced so far in working on this part of the evaluation? And then how have you overcome, or how do you plan to overcome these challenges?
The first challenge that comes to mind is just how busy and stretched professionals and support services are. This won't come as a surprise to anyone who has ever worked in a support service, but both COVID and now the cost of living crisis have probably made it a lot worse. This means that talking to us and the evaluation team for an hour as part of the evaluation is just another thing on a to-do list that's already way too long anyway. So it can be difficult to find a good way or time to talk to professionals without making them feel even more overwhelmed. At the same time, they often really want to talk to us and share their knowledge and expertise. They want their experiences to be shared and inform policy and decision-making. And research and this evaluation are a great way to make sure their voices are heard. Professionals want to talk to us and feed into the evaluation, but often that's more difficult in practice.
And finally, what work do you plan to carry out over the next year?
Basically, we're planning to do more of the same. What that means is we will continue to speak to people involved in ABS, and we do that to build a better picture of all the things that are happening as part of ABS. This autumn, we will go back to people we spoke to earlier this year and continue our conversations with them and delve in deeper. Then next year, we will reach out to new people and are aiming to speak to another 50 people involved in ABS. We want to hear people's views on what ABS is like for them. That's the only way we and everyone else will be able to learn from the ABS experience.
Wonderful. Thank you very much, Rebecca. We're going to turn now to Professor Janet Boddy from the University of Sussex, who is leading on the work with families. Janet, can you tell us a bit about the work that the University of Sussex is leading for the evaluation?
Of course. Thanks, Yona. As you said, our Sussex team is leading on the research with families, aiming to understand their experiences over time with ABS. We're speaking to families in all 5 of the ABS partnership areas. We're talking to a wide range of families from different backgrounds to try and capture different kinds of experience with ABS. And to get an in-depth understanding, we're working with a small number of families, initially 25 across the 5 ABS partnerships, and we're speaking to them twice a year over 4 years. So once a year, we'll visit the family in person, talking to parents and carers and doing some activities that involve the whole family. And then midway through the year, we do a catch-up shorter interview by phone. And taken as a whole, that gives us the detail we need to understand families' journeys through ABS and how those fit into the big picture of their lives over time.
Can you tell me a bit about what you've been doing so far?
Yeah, we began with really important work consulting with expert panels that were set up for the evaluation. So a panel of parents and carers and a panel of ABS practitioners. And they've been helping us work out the best ways to approach the research. What we then did was speak one-to-one with some of the families from the parent and carer panel to test and develop our approach. And following that, we've been working with the ABS partnerships to identify families to take part in the research. And we're now just completing our first set of interviews with families. And I have to say, we're really excited about how well the interviews have gone, and also extremely grateful to all of the families who've taken part for their time and their warm welcomes.
Can you give us an overview of what your part of the evaluation has found so far?
Well, it's too early to say much about what we've found from the interviews that we've done so far. So I'll just have to come back and talk to you again on that one. But what I can say, having spoken to families in all 5 of the ABS partnership areas, is that we've learned about the diversity of families who access ABS and the different kinds of involvement that they have. And we're also starting to identify some common experiences across the 5 areas. In addition, we've learned a lot from the other work that we've done so far. So if you like, I can talk a bit about that.
Sure.
So for us to know how to ask about ABS provision, we first of all need to know how families experience ABS. And the flexible place-based approach means that the 5 ABS partnerships often work differently, although they're working to the same core outcomes. ABS provision's also very embedded in the local areas where families are living. And so families might be doing things that are supported by ABS without necessarily seeing it in those terms. So to give you one example, ABS might have supported improvements to a local park, and a family might not know that, even if they love using that park. So it's really important to make sure that we don't miss that kind of experience. And our strategy is to take a very rounded approach to understanding family lives from their point of view. And we can then connect that with the site-specific learning that Rebecca has told you about. So we're kind of joining the dots to understand how local ABS provision fits with what families say about what matters in their lives. And we've been working with the Parents and Carers panel to make sure that the research takes a family-focused approach and a family-friendly approach. We work flexibly according to families' preferences and their needs. And that also means that children and other family members can join in with parents and caregivers if they want to. And families are doing things like making maps of important places and taking photographs of things that matter in their everyday lives. And working in that way helps us to see things from their point of view. But it also means that even very young children can get involved, taking pictures, putting stickers on maps to show what they like or they don't like, that kind of thing.
What have been the main challenges you've had so far in working on this part of the evaluation? And how have you overcome, or how do you plan to overcome these challenges?
It's taken a bit of time to put together that group of 25 families for the main interviews. And the ABS partnership areas have been really helpful, identifying families that meet our criteria and that give us the kind of variety that we need to include. But it's important to recognise that it takes time to get that right. And also just really making sure we include people that are happy to take part. It won't be a problem to catch up on the time that we've spent identifying families. It's much more important that we make sure we get things right. And we're really pleased with how things are going. So the approach that we've worked out with the help of the Parent and Carers panel has been very well received by the families we've spoken to. And it works really well, showing families' experiences of ABS involvement over time and showing what kind of difference ABS can make to complex and varied family lives.
And what work do you plan to carry out over the next year for this strand of the evaluation?
Our next step is to analyse all of that rich information that we've got from families in the first round of interviews. And then the learning from that will go into a report to the National Lottery Community Fund. We're then also starting to prepare for the next set of interviews, which will begin in December of this year.
Thank you very much, Janet. Really appreciate it.
Thank you. Thank you.
We're turning now to the part of the evaluation which considers ABS costs and value for money. And we'd like to introduce Beth Young from RSM UK. Beth, what activity have you completed so far?
Well, we're aiming to evidence the contribution that the ABS programme has made to reducing the cost to the public purse relating to primary school age children. The idea being that A Better Start's focus on prevention and early intervention and systems change has the potential to create public benefit by avoiding costs later in the children's lives, that is, between the ages of 5 to 11 years old. Given the complex nature of the A Better Start programme, we're using cost consequence analysis, sometimes referred to as CCA for short. Cost consequence analysis is an economic evaluation approach, which has been recommended for complex interventions like ABS that have multiple effects. This is because it can capture a greater range of outcomes that would be difficult to express in a single unit. It will allow us to assess a wide range of costs and the resulting consequences or effects of ABS and report them separately, instead of trying to aggregate all of our findings into a single metric. The output will be a set of summary tables describing the costs and benefits of A Better Start at a partnership and programme level, quantifying what can be quantified and describing the rest, but not aggregating everything. Our approach involves understanding the following 5 questions. Firstly, what are the costs associated with the ABS programme? That is, the resources and the inputs at a programme level and for each partnership. We also want to understand how these resources and inputs are used to deliver the ABS programme at a programme level and for each ABS partnership. These are the shorter term effects or the outputs, such as services delivered and beneficiaries reached. The third question is, what are the expected outcomes from these activities? And these are the benefits of the ABS programme, including the positive outcomes achieved and the negative outcomes avoided in the short and longer term, compared to the counterfactual analysis and the match comparison groups being developed as part of Objective 1. We're also seeking to answer how these changes in ABS outcomes are likely to impact public sector activity relating to primary school age children. This is about understanding the changes in staff time and resources. And the fifth and final question is, what is the value of that change in activity or the public sector costs avoided? To start addressing these questions, we had a series of meetings in phase 1 with the National Lottery Community Fund and the local ABS partnerships to understand what costs were associated with delivering the ABS programme and what financial information is being collected that could inform our evaluation. We also undertook a desk-based review of publicly available expenditure data on education, health and social care, and children and young people's services. This confirmed that data is not available at ward level. We've also collated some of the secondary data required to inform our modelling of the potential cost savings relating to primary school age children. This has included sources of unit cost data and existing economic studies of the impacts of early years interventions to identify potential medium and longer term benefits and cost reduction to the public purse relating to primary school age children. This has identified over 200 studies, which we've mapped to the ABS core domains, as well as the short, medium and long-term local and national level outcomes that ABS has aspired to achieve. During phase 2, we've held 2 virtual workshops with ABS partners to agree a consistent approach to reporting their leverage funding and mapping spend data to outcomes. We're currently working with the 5 ABS partnerships to map their spend to date to the ABS Common Outcomes Framework measures as far as possible.
Beth, what would you say have been the main challenges you've had so far in working on this part of the evaluation? And it would also be great if you could tell me how you've overcome or plan to overcome these challenges.
Sure. The main challenges so far stem from the complexity of the programme and the no one-size-fits-all approach that the fund has adopted. While that supports greater flexibility in programme delivery and reporting, it has caused challenges for our workstream in terms of making sure that there's consistency in what's being reported. And to overcome this, we've involved the 5 partnerships in the development of our approach to make sure that it's robust but still pragmatic.
And what work do you plan to carry out over the next year for this strand of the evaluation?
Our focus over the next year will be assessing how effectively ABS resources have been used to deliver the programme and progressing a literature review of cohort studies such as the Born in Bradford, the Millennium Cohort Study and Understanding Society to provide the conceptual links between observed changes in parental and early years outcomes and the correlated outcomes for children during their primary school years.
Great. Thank you very much, Beth. Thank you very much to Andy, Rebecca, Janet, and Beth for giving us an update on progress to date on the 4 different parts of the evaluation. In the next podcast in this series, in 12 months' time, we'll be able to chat through how our evaluation work is developing, any new challenges which have come up along the way, and the findings of our work over the intervening 12 months.